We know you do have a concern with is the whole debate over federal funds for abortion procedures.
Correct.
And you are the leader of as many as 40 like-minded members in the House of Representatives. Will you talk to us about your concerns?
Sure. We believe, and the majority of American people believe, that we should not be using public funds to pay for abortion coverage in health care. That's been federal law since 1976. We want that law to continue. The President came before the Congress and said in his plan there would be no public funding for abortion. We're holding the President to his words. We do not want to see taxpayer funds being used to pay for abortion. And again, that's not only the view of 40 of us who have said if you're going to bring this issue up, we want to vote on the floor whether or not there should be public funding for abortion. I sit on the Energy and Commerce Committee, as you said. We lost the amendment to knock out public funding for abortion. We lost, I think it was 30 to 28, I think it was 2 votes. And we want a right to bring this issue forth on the floor and decide as a nation, is this going to be a paid-for benefit by taxpayer dollars? We don't believe that's where the majority of Americans are. We believe if we get a vote on the floor, we would be able to knock that part out, the public funding for abortion.
And what is leadership telling you?
Not a lot. We talk back and forth trying to find some common language that we could all agree with. Unfortunately, there's been no agreement. It still gets down under H.R. 3200, the House bill, the one I'm most familiar with. There's these affordability credits, and in other words, you get a refund, if you will, from the federal government to help pay for this tax, help pay for this health care. So what we're saying is if you're receiving affordability credit, you cannot buy, taxpayer subsidies, you cannot buy a plan that has abortion coverage in it. And we just can't get by that. They want to say, no, even if you get a subsidy from the federal government, you should be allowed to buy abortion coverage with that subsidy. And that's where we can't go. It's called the Hyde Amendment, no public funding for abortion. Like I said, it's been the law since 1976. If you want to do health care, that's one thing. Let's not be changing the law on abortion coverage.
Are you and your 40 colleagues willing to vote no on the entirety, the piece of legislation, if this language is in it?
Somewhere in this process, we have to have an opportunity to vote our conscience. In other words, we have to have a vote or we're going to try to take down the rule. If we do not have the vote, most members of the 40 there will not vote for the bill. I still want to see how it plays out. I'm still somewhat optimistic somehow we'll get a vote, either through a rule or on the floor or a motion to recommit or somewhere along the line we get to have that vote. I, for one, would like to vote for health care, but I really do have this hang-up that we should not have public funding for abortion. I don't think it has any role to be in here. The President indicated the bill would not have it, so why are we even having this discussion? Let's just go back and keep current law.
Lots of calls for you. Before we do, last question from me is what are the calls and email messages coming into your office since your position on this has become well known?
Well, it's all over the place. I was in town halls. I did town hall meetings this last weekend in my district. Most people applauded the position. There were a number of diehard Democrats, if you will, who were upset with my position. Of course, my position, being pro-life, is contrary to that of my party. So the real adamant Democrats probably are not real happy with me right now. Speaker's not happy with me. But, you know, it's been the law. And everything I looked at, by 2-to-1 margin, when you take polling, people say, look, you're going to have health care? Great, fine. But do not have public funding for abortion. By 2-to-1 margin, they're against public funding for abortion. I don't know why we have to change that basic principle in our law, especially in the health care bill.
You called this a vote of conscience. Are you willing to proceed even if it costs you your seat?
Yes. Yes, I'm comfortable where I'm at. This is who I am. It's reflective of my district. If it costs me my seat, so be it.
Let's take calls. Indianapolis, Paul, Republican line. You're on the air for Congressman Bart Stupak. Go ahead, please.